Hi. So today I will be discussing an alternative research paradigm to an existing research article. So the title of today's article is Adherence to Antiretroviral Therapy among HIV and AIDS patients in the Kwatemba Clinic in Gauteng, South Africa. So I chose this topic because I find it interesting and I'm also a little bit familiar about this topic. So some background information first about this topic is that this article highlights how the introduction of antiretroviral therapy has shown a reduction in HIV-related mortality in people living with HIV and AIDS. So the aim and setting, as I've mentioned, the study was aimed at determining adherence to ART among HIV and AIDS patients at the Kwatemba Clinic in Gauteng. Since adherence is crucial for treatment to prevent deaths, the research found that adherence at that particular clinic, at the Kwatemba Clinic, is only 77%. It's not that bad, but it's still below the optimal of 95%, which is actually required to achieve effective viral suppression. So basically, they need to adhere to their medication to achieve viral suppression. Okay, so researchers set out to determine how certain variables and factors influence their adherence. So things such as gender, education level, the burden of taking too many pills, feeling much better, and and then they discontinue treatment because now they think they're feeling better, migration, traveling, and maybe side effects influence their ability to adhere to the medication. Okay, so this research is it aligns with the positivism paradigm, which emphasizes objective reality and empirical evidence, and employs standardized data collection techniques. The research questions focus on cause and effect relationships and statistical analysis to validate findings, and it also uses quantitative cross-sectional descriptive design, systematic sampling, and statistical analysis via SPSS to determine adherence factors. So basically, after looking at all this information, these findings are then depicted numerically and graphically in the form of pie charts and graphs, so very quantitative. So let's discuss adjustments for an alternative paradigm. There are some adjustments I'd make in the research process to make this study design align with the critical theory perspective. So the first one, let's look at the research aim from a critical perspective. So I think instead of just measuring the ART, the antiretroviral therapy adherence rates, and influencing factors like gender and education with very short responses from the participant surveys, a critical theory lens would actually focus on developing research questions like what systemic barriers do patients face in accessing and adhering to antiretroviral treatment, and how can these be addressed through policy changes and community interventions. So furthermore, the researchers' participation can be more active during the methodology process because they're can implement qualitative methods, participatory action research can be included to include patient perspectives for the research design. For example, maybe involving the patients, the healthcare workers, and the community members in the research process, thereby empowering participants to identify issues and sort of like co-create solutions for themselves, which I think is really important. So the data collection methods from a critical theory perspective, interviews and focus groups, so conducting in-depth interviews and focus groups with patients, like I've mentioned, and everyone involved that I've mentioned previously, community workers, health group, to gather perspectives on antiretroviral adherence and maybe the systemic barriers that they face. And then maybe we can also look at analyzing existing healthcare policies and programs to identify how they contribute to or mitigate barriers to antiretroviral treatment adherence. Okay, so if we look at ethical considerations, when adopting a study to a critical theory paradigm, additional ethical considerations need to be included. I'll discuss 3 or 4 things like informed consent, confidentiality. All right, informed consent, everybody in the research process should be involved, whether it's the healthcare workers, the participants, the members, everyone. And there should be clear language as well, because we need to take cognizance of the fact that not everybody is good at English. All right, so we need to be mindful of the various levels of education. We need to mention the purpose of the research, maybe what the study involves, what the rights are as the participants, the duration, and any possible risks in the research process. And then regarding confidentiality, due to the sensitive and personal nature of these in-depth interviews, identities should be carefully protected by using other names or pseudonyms. And regarding the research findings, researchers need to disclose findings accurately, as well as disclosing errors, limitations, and I would say other possible shortcomings in the research process, just for the sake of transparency. And then empowerment is a big theme in critical theory. Participants should be treated in this process of doing research. The participants should be treated as co-researchers, actively engaging in discussions about study findings and potential solutions. So, to put it in a nutshell, the positive paradigm is more descriptive, which involves casual relationships and gauging statistically significant adherence factors, whereas the critical theory perspective is more closely aligned with the explanatory or exploratory research, as it involves mixed methods design and a more holistic approach, I would say, to identifying social and economic disparities to promote change at community and policy level. Okay, so that's it.